Assalamu alaikum guys, welcome back to my YouTube channel. Today we are going to discuss about keratoconus. So just by looking at this term, we know that there's coning of the cornea in this disease. So let's define keratoconus. It is a progressive disease of the cornea in which there is thinning and bulging of the cornea. Now you can see it in the image here that the cone shape of the cornea is something like this, and we can see this on slit lamp examination, but the confirmatory test for this is corneal topography. It will tell us about the thickness of each part of the cornea. Now, which layer is involved in keratoconus? Why is this thinning and bulging of cornea occurs? We need to look at the layers of the cornea first. There are 5 layers of cornea. If you go inwards from outside, the first layer is epithelium, then comes the Bowman layer, stroma, descemet membrane, and endothelium. Now stroma makes up about majority of this corneal thickness, this layer, and this is what is affected in this disease. Now if you look at the pathology of this, so there is defective synthesis of the mucopolysaccharides and the collagen fibers, and this will result in the fragmentation of the basement membrane of the epithelium, the Bowman's layer, and the stromal collagen fibers. Now this disease usually occurs in the teenage group. This is where it can happen. It doesn't usually affect older people or younger than this. The teenage are most susceptible to this, and the first symptom that they usually complain with, it is that they have blurring of vision and they cannot see the far objects. They are myopic, and so these people are myopic and they have astigmatism, or they can have astigmatism. These are the 2 complaints they will come up with. Now the causes of this is that the family history plays an important part. If this is in your family members, your relative, first degree, second degree, so you are more susceptible of developing this keratoconus. Then comes allergy. Now allergic conjunctivitis have 70% association with keratoconus. 70% of people who have allergic conjunctivitis develop keratoconus, so this has a very strong relation with keratoconus. And third one is that rubbing of eyes, excessive rubbing of eyes during summer season, or during when you have dry eyes or you have any allergy. So rubbing is also a known cause of developing this. Now like I said, corneal topography is the definitive tool to diagnose this, but Munson sign, there's a sign you can see. If you have the patient right in front of you, you tell the patient, or you have to stand behind the patient and look from above. You just tilt the head a bit backwards so you can see the eyes, and then you see the patient eyes, they will be bulging if he has this disease. So this is known as Munson sign. This is also positive in patients with this disease. Now treatment is that you need to pick this at the right time before the vision is so deteriorated. So the main treatment is collagen cross-linking. Collagen cross-linking, also in short we can say CXL. You have heard this term a lot. In this we strengthen the collagen fibers that are present in the stromal layer. So this prevents the further deterioration of this disease. The damage that is caused, that is already done, but we prevent the further deterioration. So the vision that is lost is already done. For that we can give the patient spectacles or contact lenses, but we have to, because this disease is progressive, so we have to stop the further progression, and collagen cross-linking is the ideal treatment for this. Now if we discuss this procedure in short, a ring is placed on the eye, the cornea, and the epithelium layer is removed, and then we give vitamin A drops for about 30 minutes, and after this the UV light is shown into the eye, and then after this this causes a chemical reaction between the collagen fibers of the stroma, resulting in its strengthening, and this results the further progression. This prevents the further progression of the coning of the cornea. So when this is done, the epithelium which is removed, so we place a contact lens in its place, and the person is discharged. He can go home, and we give steroids and antibiotics, so to decrease the inflammation and to prevent any post-op infections, and the person is absolutely fine. He has to patch the eyes, he has to stay away from bright light, and it might be a bit painful at first, but we give painkillers for that, and they usually do absolutely fine. So keratoconus is a treatable condition, it's a treatable disease, but the thing is we have to pick this at the right time, because if the cornea is so cone shaped and it is progressed to such an extent, then in the end you have to go for corneal transplant. So in order to prevent that, make sure that your child or your friends or your relative, make sure they do not have this disease and you take them to an eye doctor on time. If you guys have any more questions regarding keratoconus or its management, please leave it in the comment box and I will try to reply. Until my next video guys, take care.